Our top story this morning, let's look into it in a little bit more detail. The important and, in many respects, concerning news about women's heart health is coming out from Dutch researchers today. They spent 6 years studying cardiac arrest and came up with some very interesting gender differences and the serious consequences for women in particular. One of the big numbers, women less likely to survive a cardiac arrest. Cardiac arrest, bigger killer than breast cancer, 5 times more likely to kill a woman, which is a surprise to many. And here's an important number, too. Women less likely to receive CPR from a bystander, less likely to be resuscitated or attempted resuscitation from a bystander. 68% for women, 73% for men. And that's one of the really interesting numbers that we're going to talk about in more detail now with Dr. Chris Simpson. He's a cardiologist, the former president of the Canadian Medical Association. He's a professor at Queen's in Kingston, and that's where we've reached him this morning. Dr. Simpson, thanks for coming in and helping us understand this study better this morning. Good morning.
Good morning. It's a pleasure.
Let's get our terminology lined up to begin with, because I think one thing that we need to be clear about is many people think cardiac arrest is the very same thing as heart attack, and that's not the case. So help us understand the definition simply, first of all.
Right. Well, you're absolutely right. They're commonly confused. A heart attack simply is a plumbing problem where an artery leading to the heart becomes blocked. It starves the heart muscle of oxygenated blood and damage is done. But typically with a heart attack, the heart continues to beat. A cardiac arrest, on the other hand, is an electrical problem where the normal electrical activity of the heart is replaced either by no electrical activity or very chaotic electrical activity, and this results in the heart actually seizing or stopping or arresting. The reason I think they're confused a lot is that heart attacks often cause cardiac arrest. So in the early phases of a heart attack, cardiac arrest can be a fatal complication. So they're often connected. But cardiac arrest can occur outside the context of a heart attack as well.
Okay, thank you very much. But if we think of heart attack as being a leading or the leading cause of cardiac arrest, so that's a factor, not the same thing. Starting from that standpoint there, then looking to this European study, which we found so interesting this morning, that women are less likely than men to survive a cardiac arrest. And the study's clear that more research is needed on this particular area. But based on the best information we have right now, why is that?
Well, these researchers found a very interesting finding. It turns out that not all cardiac arrests are the same. Some of them can be from a chaotic rhythm like ventricular fibrillation or VFib, or its cousin, ventricular tachycardia, or VTAC. And these are known as shockable rhythms. So if you find somebody in this rhythm in cardiac arrest, you can apply the pads and apply energy and shock them, and they will recover. But there are also non-shockable rhythms that can cause cardiac arrest, like flatlining, also known as asystole, or something called pulseless electrical activity, which means the heart just doesn't, the electrical impulse isn't translated to the heart properly. Either way, the heart has stopped. But the shockable rhythms will respond very nicely to an electrical shock, and the non-shockable rhythms won't. And it turns out women are far more likely in a cardiac arrest situation to have a non-shockable rhythm. And it turns out from their analysis that this is the major reason why women don't survive cardiac arrests as often as men do, and it's because their arrest is fundamentally different.
And part of the study as well was, again, based on gender, was looking at the symptoms. They don't even necessarily know what they're responding to because people recognize symptoms differently. They vary, they differ between men and women. The symptoms of heart attack, which could then lead to cardiac arrest. Can you go through those symptoms for us? Because I think that's worth bearing some time thinking about today. Men, let's start with men, because that's the common sort of grab the chest, the Hollywood-style heart attack, right, for men?
Yeah. Exactly, and this is the way that it's portrayed in Hollywood, as you say. There's this crushing or heavy feeling in the chest. It's in the central chest. Men will often bring up their hands and squeeze and give you sort of a visual of what it feels like. They'll feel very sweaty and very unwell. Women can have exactly the same presentation as well, but they're more likely to have more what we call nonspecific symptoms. So it might be shortness of breath or nausea or pain in the jaw or ear, something that doesn't necessarily point you directly to the heart specifically. So historically, this has often meant that women's heart attacks go unrecognized for longer.
That's an important thing to keep in mind, again, reinforced in this study. And the other thing that caught our eye, the big number that came out that I was mentioning in introducing you, that bystanders are less likely to try to resuscitate a woman than a man when she's having complications and when her rhythms are all out of whack. 73% resuscitation attempts for men, just 68% for women. And some of the reasons for that, societal. Maybe don't want to give CPR because they don't want to hurt a woman's chest, don't want to compress a woman's chest for fear of that taking on a sexual connotation. This was all clear in the study. So as we look at that, I'm wondering what your thoughts are in general.
Yeah, I think the points you've raised are important ones that have likely played a role in this difference. Typically, we ask people to expose the chest when they're going to apply chest compressions, and so in the moment of a cardiac arrest, there may be some hesitation or additional hesitation or different kinds of hesitations around exposing a woman's chest versus a man's chest. I think the other potential component is that in general society, there's still a general belief that women don't get heart disease as much as men do. This is false, of course, but if you were to find somebody unconscious on the ground and it's a woman, the initial impression might be, well, this is a faint, it's a benign faint, it's not a cardiac arrest, and that might lead to hesitation. So I think all of these societal influences are probably responsible for that difference between bystander intervention with women versus men.
So could you leave us with a parting takeaway message in terms of public understanding based on this new study and these findings, Dr. Simpson?
Well, I think the big takeaway is that if you happen to see or come across somebody who is unconscious and not breathing, you can wait maybe 2 or 3 seconds to make sure that they don't make spontaneous recovery. But if they're not waking up very, very promptly, you need to call 911. You need to initiate CPR if you know how to do CPR, and everybody should know how to do CPR. And ask people around you to look for an automatic external defibrillator and get the defibrillator on the patient as quickly as possible. The machine will guide you through what to do, and you can save a life.
And you just have a very short matter of minutes to do so. So thank you for that reminder as we think about our heart health this morning. Dr. Chris Simpson in Kingston, thank you, sir.
Thank you, Heather.